Today we are covering therapeutic drug monitoring, specifically peak versus trough levels, a critical topic for the phlebotomy exam. The entire purpose of this testing is to ensure a medication is within its effective or therapeutic range, not too high to be toxic and not too low to be useless. As a phlebotomist, your role is all about timing. The accuracy of these results depends entirely on you drawing the blood at the precise moment. Let's start with the trough level. The trough is the lowest concentration of a drug in the patient's bloodstream. To measure this, the blood must be drawn just before the patient's next scheduled dose. For example, if a patient is scheduled to receive the antibiotic vancomycin at 10 a.m., the trough level should be drawn shortly before that time, often within 30 minutes. This timing is non-negotiable and is a frequent subject of exam questions. The test requisition will state trough level, and you must coordinate with the nursing staff to ensure you draw the sample at the correct time before they administer the next dose. Now for the peak level. The peak represents the highest concentration of the drug in the bloodstream. Unlike the trough, the timing for the peak draw varies significantly depending on the drug and how it's administered. For an intravenously administered drug like vancomycin or gentamicin, the peak is drawn after the infusion is complete, not when it starts. This is a classic exam trap. For vancomycin, the peak is typically drawn 1 to 2 hours after the IV infusion has finished. For gentamicin, it's often 30 minutes after the infusion is complete. The exam will test you with scenarios. For instance, a question might state, the nurse completed the vancomycin infusion at 9:30 a.m. When should the phlebotomist draw the peak level? You would need to calculate the correct window, which would be between 10:30 a.m. and 11:30 a.m. Another common trap is documentation. You must meticulously document the exact time of your draw on the specimen label and requisition form. A few minutes can make a significant difference in how the results are interpreted by the physician, so precision is key. The exam will emphasize your role in ensuring sample integrity, which includes not just the timing, but also correct patient identification and using the proper collection tube, typically a serum separator or red top tube. To help you remember this on exam day, use this simple phrase, trough is low just before the go. Peak is high after it's all inside. This reminds you that the trough is the lowest point and is drawn just before the next dose is ready to go, while the peak is the highest point and is drawn after the medication is fully administered. Mastering the specific timing for peak and trough levels is essential, as it directly impacts patient safety and treatment efficacy, making it a heavily tested area for phlebotomists. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.